And the biggest problem is that we cannot test for it.
Hey guys, what's going on? This is Paul Rebella from ProPhysique.com, and today we have a special guest. This is my friend, Dr. Alonso Osorio. How are you doing, sir?
Hi, how are you? I'm fantastic. Thank you for having me over. I'm super excited about this.
Well, first of all, Alonso just started a YouTube channel. He's a medical doctor here in Tampa. So why don't we talk a little bit about if you want to subscribe to his channel, I'll link it below, but why don't you talk a little bit about what you do for a living?
I'm an emergency physician, and for the last 11 years, I've been in the front lines of providing emergency care in a large trauma center here in town, and I've been in other cities as well.
Yeah, so being friends with Alonso, I thought it was a good opportunity. Why don't we come in and talk about dispelling some myths, maybe
Absolutely.
Giving people an opportunity to understand, because the typical person that watches my channel is a fit, healthy person. They're interested in fitness, bodybuilding, being muscular, lean, happy, and healthy, right? So it might not be the populations that's most at risk.
Just like my patients, huh?
No. So, why don't you give us a little rundown, because you've been working up until yesterday in the ER. So give us a little kind of a short story of what's going on. What is it like right now?
It's been rather panicky creating the whole situation. We have dealt with this in the past, and I think the social media and the media in general are just kind of massively amplifying the proportions of what this is. And the biggest problem is that we cannot test for it. So if we talk on lethality for a virus like the flu of 8%, and you have a small denominator, obviously that's going to get bigger. So if you measure 8 by 100,000, and suddenly we're not testing, so we don't know what's the denominator that we're dealing with. So you see a huge lethality based on the raw data, but that's not objective epidemiologic data. So we need to kind of start adapting as it goes.
Well, and even in China, because I've been trying to keep up with what's going on there, because they're a little bit farther ahead of the curve as far as we are, as far as the infection rate and the recovery rate. They're showing something like 80% of individuals that get this recover with no impact to their life.
Absolutely. And the thing is that maybe up to 90%, some data in different countries like North Korea, South Korea, Taiwan.
So is this something that we would typically just treat with like an antibiotic, or just kind of
That's what has been difficult, giving people reassurance, making them understand the difference between virus and bacteria, because they think that, a CPAC is going to dry them up and make them feel better. It's more about like staying home, staying healthy, staying hydrated, take decongestants, and just manage it like any other flu, any other cold.
So just making sure you're taking care of yourself and not infecting others.
Yes, and we need to be a little bit, stop being selfish and kind of have more like a global mindful mindset on how to stay away from other people, not just me.
Right. So what has the situation been? Are people coming in asking for tests or trying to get information from you guys?
Well, as of today, the situation has drastically changed. The Department of Health changed it, but last week, and as of yesterday, the emergency rooms are feeling remarkably overwhelmed by the amount of patients just asking to be tested that are completely asymptomatic. So if you have no symptoms, what's the point of testing you when you're just getting yourself exposed to more people that are ill and truly ill, sneezing and coughing on top of you in the waiting room of an emergency department?
Well, they're planning the drive-up tests where people are going to be basically in like hazmat suits testing people, so there'll be less risk of infection through that.
Yes.
Right?
So right now, Broward County, that has the highest percentage of infections in the state of Florida, is setting up through the government and the government officials and the Army and the Guard, the National Guard, to help them protect this car line that is going to be happening in Broward County community. So, it's coming along, and we are going to implement probably within the next 1 or 2 weeks in our own hospital some sort of tent.
So even your family was affected by this, because you were expecting to go to Colorado the other day. So, what is your take on the situation? How should the average person that is going to be going on a vacation, or how should our behavior be changed right now?
It's all about staying away from people, 6 to 10 feet away from people. If you're obviously symptomatic, try not to expose the healthy people, because of the harm that you represent to the community. Eating healthy, avoiding touching your face. And, I know that that's difficult, but common simple things that we have been doing for hundreds of years, that is just simply hand washing and personal hygiene. And we just realized that actually works.
Yeah. So do you feel this is just the perfect storm of a disease that's got like a catchy name and the right like atmosphere of social media fear and maybe political stuff going on that they've really pushed an agenda, or do you feel this is something that requires this type of like?
Is a perfect storm. I mean, I cannot deny the disease is there, but I think since we're not testing, we don't know the proportion. I can tell you that in Italy, it just kind of blew out of proportion because they have a huge percentage of population that are over the age of 80, and they had the highest lethality, and we're seeing that. That's why they saw themselves in such a crisis, and they were not having any testing. So I think as we move along, things are just going to probably get a little bit worse. I suspect that within the next 7 to 10 days, the epidemic is going to be at its peak, and I'm going to be in the worst of dealing with people, and probably I might get infected.
Yeah, so let's talk about who's really at risk. So you said people over 80.
So people over 80 are smokers. Believe it or not, America is perfect target for the obesity population. Obesity is huge because it's little people with small lungs in huge bodies.
Okay.
And we have the people with cancer, dialysis, immunosuppressed. We talk about diabetics as smokers. In general, anybody that has a compromised immune system.
So those are the people that should really try to avoid the possibility of infection. And if you're somebody that's going to be around them, like I know my wife is avoiding going and seeing her aunt and her mother for those reasons.
Yeah, we're doing the same. I'm going to try to stay here, just not expose myself to any patient by doing how. I'm going to wash my hands on every encounter, minimize the risk, and do the best I can so I don't bring the disease at home.
Yeah. Anything else that you want to think about that's been relevant in the last couple of weeks as this has become kind of?
I just want people to understand that we have dealt with worse situations than this before, and at this point in time, the problem is the rate of this is very virulent. What I mean by virulent is highly infectious, and everybody that is being tested is obviously pretty much that is symptomatic being positive. So there is not much we can do unless you develop serious respiratory symptoms.
Okay.
My advice is just stay home otherwise, or if you're really feeling short of breath or that you're literally flooding, that might be a little bit too late. So just be wise and just kind of use common sense.
All right. Well, you heard it from Dr. Alonso. So probably have you more on these episodes as things come up. I think it'd be good to get a medical perspective.
I'm excited. I think public awareness is the key, and to calm the fears, because social media is just blowing this out of proportion.
Yeah, and I think from my perspective is, almost like, I don't want to call it an overreaction because there needs to be a reaction, but with the political climate, what is it? Sometimes it just feels like they're using this as an opportunity to talk more and be heard more. I don't know. I'm trying to remain calm, but our lives are being impacted in a pretty heavy manner. But I think it's an actual good opportunity for us to kind of appreciate we have. It's been good for us to be home with the kids and in the neighborhood the last couple of days and kind of go, hey, we don't have to be running around all the time. We can actually just pull back and enjoy a little bit of, I don't know,
just do nothing. Just do nothing. Sometimes it's good to do nothing.
So, all right, guys. Well, that's it from Dr. Alonso. If you have questions, leave them in the comments section. I'm going to get him on here to answer those questions. And also check out his YouTube channel and his podcast, which I will link below. All right, guys. Talk to you tomorrow.
Bye.